uptick in new COVID cases, things like testing and PPE remain really crucial to fighting this virus. But soon, key funding that helps support everything from vaccinations to testing could soon wind down. Joining us now is the former acting CDC director, Richard Besser. Doc, thanks for coming on. We should say you also serve as the president and CEO of the Robert Wood Johnson Foundation. Doc, let me see if I have this right. We're talking about public health emergency declaration here. Started at the beginning of the pandemic, just renewed for 3 more months, and it really does provide affordable, high-quality health insurance to a lot of folks who don't have it otherwise. For folks like yourself, you're concerned about the transition out of this, whether that happens in July or if this declaration gets pushed back again.
Yeah, that's right, Ben. You know, we're in a situation where we all want this pandemic to be over. We're tired of living in this state of anxiety and stress in this emergency situation. But the declaration of a public health emergency, it doesn't just mean that, wow, there's something going on here. It actually gives the federal government and state governments authorities and abilities to do things that are so important to ensuring that everyone in our country has the tools they need to protect their health. And what we're calling on is for the government to do the intentional planning to make sure that when this public health emergency declaration finally expires, and I don't know when the right time is for that to happen, but it's not now. When that happens, we want to make sure that people have access to vaccines for free, for testing, for the drugs that we know can be so effective. And right now, those systems are not in place. There are millions of people who would lose access to the services they desperately need to stay healthy during the rest of this pandemic.
I'd be remiss if I didn't get your reaction to the idea that folks are no longer having to wear masks on public transportation like airplanes, trains, and buses of the sort. Do you think it's too early to let our guard down?
Well, what really concerns me, Ben, about that is a judge saying that the CDC doesn't have the authority to require masks. Because we can debate whether or not they should be required. I think it's not going to be long before it does come down to a personal choice because there are high quality medical masks available. But I do think letting it stand that the CDC doesn't have the authority to protect our health as a nation, that is really scary for the next public health threat that we face. You know, what I would love to see is, you get on a bus, you get on a plane, you're about to sit down and you look and you see the person sitting there is wearing a mask. And you say to them, I'm not wearing a mask. Is that okay? Or would you feel more comfortable if I put one on? Because you don't know what that person is going through in their life. You don't know their medical condition. And if we just showed some more kindness to each other, the idea of mandates wouldn't be so necessary. Just look out for each other. If we had that sense as a nation that I'm responsible for my health and the health of my family, but what I do actually has an impact on the health of those around me, and it's actually a gift to be able to do something that helps keep someone else safe.
Dr. Besser. Doctor, thanks for coming on. We appreciate it.